Hi, welcome to the Professional Certifications channel. In this video, we will explore common questions asked by JCI surveyors and provide answers on the International Patient Safety Goals, IPSG. Tell me, how do you prevent a patient harm from falls in outpatient settings? Preventing patient harm from falls in outpatient settings involves a proactive and comprehensive approach that includes environmental modifications, patient education, staff training, and continuous monitoring. Here are key strategies to prevent falls in outpatient settings. Environmental modifications. 1. Safe environment. Ensure that all areas, including waiting rooms, examination rooms, and corridors, are free from clutter and obstacles. Maintain adequate lighting in all areas, particularly in hallways and bathrooms. 2. Non-slip surfaces. Use non-slip mats and flooring in areas prone to getting wet, such as bathrooms and entrance areas. 3. Handrails and grab bars. Install handrails along corridors and grab bars in bathrooms to provide support for patients. 4. Seating and furniture. Provide stable, comfortable seating in waiting areas and examination rooms. Ensure chairs have armrests to help patients get up and sit down safely. Patient assessment and education. 5. Fall risk assessment. Conduct fall risk assessments for all patients, particularly those with a history of falls, mobility issues, or use of medications that affect balance. 6. Patient education. Educate patients about their fall risk and provide tips for preventing falls, such as proper footwear and safe home practices. Encourage patients to report any dizziness, unsteadiness, or previous falls. Staff training and awareness. 7. Staff training. Train all staff members on fall prevention strategies, including how to assist patients who are at risk and how to respond if a fall occurs. 8. Awareness campaigns. Implement awareness campaigns within the outpatient facility to highlight the importance of fall prevention. Monitoring and assistance. 9. Close monitoring. Keep a close watch on patients who are identified as high risk, especially when they are moving from one area to another. 10. Assistance with mobility. Offer assistance to patients with mobility issues when walking or transferring from one place to another within the facility. 11. Use of mobility aids. Provide and ensure the proper use of mobility aids, such as walkers and canes, for patients who need them. Clear communication. 12. Signage. Use clear and visible signage to indicate areas where caution is needed, such as wet floors or uneven surfaces. 13. Patient instructions. Give clear instructions to patients about where to go and what to do, minimizing confusion and the risk of falls. Emergency protocols. 14. Immediate response plan. Have a clear and immediate response plan in place for when a fall occurs, including assessment of the patient and provision of first aid. 15. Incident reporting. Document and report all falls, even if no injury occurred, to understand the circumstances and prevent future incidents. Continuous improvement. 16. Regular audits. Conduct regular audits of the environment and processes to identify potential fall hazards and areas for improvement. 17. Feedback and evaluation. Collect feedback from patients and staff about safety and implement improvements based on this feedback. Example fall prevention plan for outpatient settings. Patient, John Doe appointment, 10 a.m., room 5. Risk factors identified. History of falls. Use of sedative medication. Mild mobility issues. Interventions implemented. 1. Safe environment. Ensured waiting area and examination room are free of clutter. Checked that non-slip mats are in place in the entrance and bathroom areas. 2. Patient education. Educated the patient on the importance of wearing stable footwear. Discussed potential side effects of medications related to balance and dizziness. 3. Staff assistance. Assigned a staff member to assist the patient from the waiting area to the examination room. Provided a walker for use within the facility. 4. Monitoring. Monitored the patient closely during the visit, especially when moving between areas. 5. Emergency protocol. Reviewed the emergency response plan with the staff in case of a fall. By implementing these strategies, outpatient settings can effectively reduce the risk of patient falls and enhance overall patient safety.